Over 200,000 Americans and 25% of people over age 80 in the United States have atrial fibrillation. Atrial fibrillation is an irregular rhythm of the heart, which can cause an increased risk of stroke and, if left untreated, can cause congestive heart failure. First-line therapy for atrial fibrillation is medication to control the heart rate and rhythm, and blood thinners to reduce the risk of stroke. Some people go on to have catheter ablation to treat their irregular rhythm, but both of these require the continued use of blood thinners to reduce the risk of stroke. For patients who medication or catheter ablation is not effective, and for patients who have complications from blood thinners or would like to be off of blood thinners, for these patients, the Heart Rhythm Society recommends hybrid ablation to treat their atrial fibrillation. This is a combination of a catheter ablation with minimally invasive surgical ablation of the outside of the heart and closure of the left atrial appendage. By closing the left atrial appendage, the site of 90% of blood clots from atrial fibrillation is eliminated, and most patients can come off of blood thinners. The combination of minimally invasive surgical ablation and catheter ablation cures 80 to 90% of people of their atrial fibrillation. Ablation is a generic term which refers to either burning or freezing the heart tissue so as to create scar. The scar tissue prevents the conduction of abnormal electrical signals from the areas of atrial fibrillation to the rest of the heart. When we perform ablation, we can either do it with a catheter, which is done by an electrophysiologist inside the heart, or we can do it surgically by applying tools to the outside of the heart, which will either burn or freeze the tissue and create scars, blocking the abnormal electrical signals. Most of the patients that I see for hybrid surgical ablation have had previous catheter ablation, which did not work, or have complications from blood thinners and need to get off of blood thinners. For these reasons, hybrid surgical ablation can increase the chances of curing their atrial fibrillation and will always eliminate the left atrial appendage, which is the site of most strokes from atrial fibrillation. Hybrid surgical ablation is a minimally invasive procedure which is done with a video camera, and most patients are able to go home 2 or 3 days following the procedure, and typically would return to work approximately 2 to 3 weeks after the procedure. After discharge from the hospital, patients will return to the office to reevaluate their rhythm in approximately 1 month with both the surgeon and the electrophysiologist. Most patients will then undergo a catheter-based mapping procedure 3 to 4 months following the procedure to assess the areas of ablation and do any additional ablation that's necessary. For patients who have atrial fibrillation and can't tolerate medications, cannot take blood thinners or want off of blood thinners, or have had catheter ablation previously that did not work, then hybrid surgical ablation may be for you.